Harvard Medical School. Infectious diseases from a diploma from UNSW Australia. International course in vaccinology from CMC Vellore. He has also been an active member of antimicrobial stewardship program for some of the best hospitals, including Lilavati Hospital and Research Center, PD Hinduja Hospital, and also Asian Heart Hospital and Research Center. He is also a JCI and an NABL internal auditor, NABH assessor, Kahos CSSD auditor, and Ramkrishna Bajaj Quality Award auditor. He is also a certified Six Sigma Black Belt. So, Dr. Rahul, I take this opportunity to welcome you to NHCA live webinars. It's a great pleasure to have you with us.
Thanks, Dini, for a very kind introduction, and a very good evening to all the participants here. And thanks to the NHCA team for giving me this opportunity to speak on this esteemed platform of NHCA on a topic of my passion, that is infection control. So it's a 1 hour session that I will be having in a short time. Let us proceed with the presentation now. Shall I proceed, Dini?
Yes, thank you, sir.
So in this session, we'll be learning what do we mean by healthcare associated infections, what are the measures to be implemented, how to implement it, how to manage the occupational exposure to blood and body fluids, what do we understand by antimicrobial stewardship, and what are the strategies, and how do we manage the biomedical waste. Let us first understand the basic thing, that is what is meant by healthcare associated infection. So I will explain here. Healthcare associated infections are those infections which were not present at the time of admission, nor it was in the period of incubation. Now let us understand the word incubation. Incubation means the time period from the onset of infection till the appearance of signs and symptoms. Now incubation, now the healthcare associated infections are mostly due to Enterobacteriaceae, that is E. coli and Klebsiella. And since the incubation period of these organisms is about 48 hours, hence those infections which are evident 48 hours after admission to the hospital are termed as healthcare associated infections. Now, it's very important to understand that is all the definition or the identification of healthcare associated infections depends upon the incubation period. If the healthcare associated infection is due to a bacteria such as Pseudomonas, whose incubation period is about 72 hours, or if it is a virus, its incubation period is about 5 to 15 days. If the infection gets evident after this incubation period of these pathogens in an hospital setting, then those infections are called as healthcare associated infection. Now, this term differs from the word nosocomial infection or hospital acquired infection also. Nosocomial infection word is now a misnomer. It was limited to infections of patients during their stay in the hospital. Similar is the case for hospital acquired infection. But healthcare associated infection is a broader term which includes infections among patients as well as amongst the staff also. And it's not only limited to during the stay in the hospital, but also after discharge also. So that is the definition of healthcare associated infection. Let us see in detail. A particular infection should be considered healthcare associated only if it was not present or incubating when the patient was admitted to the hospital. The infection does not also represent a complication of an already existing infection. Suppose a patient gets admitted to the hospital with Klebsiella infection, then the same infection gets complicated after 48 hours or 2 to 3 days after his admission. That infection will not be labeled as healthcare associated. But if that patient develops a secondary infection to Pseudomonas and other, that will be labeled as a healthcare associated infection. Also, the infection occurred more than 42 to 72 hours after admission and within 30 days following discharge is a healthcare associated. It can be longer if it is in a surgical procedure. Now, let me clear here the confusion which is commonly asked. Implants, we do the surveillance till 1 year. Now, as per the latest CDC guidelines, as per the definition, it should depend upon the type of surgery. It can go up to 30 days post-operation or 90 days post-operation, irrespective of the implants. Now, which infections are not considered to be associated with healthcare? Those infections which are associated with complications, as said before, at the time of admission, unless a change in pathogen suggests that the infection has been acquired after hospital admission. Now, infections such as transplant-related infections such as toxoplasmosis, rubella, cytomegalovirus, herpes simplex, or syphilis, which occurs among infants, which are acquired transplant-centrally and manifests less than 48 hours after birth, are not healthcare associated. Also, reactivation of a latent infection such as herpes zoster or tuberculosis or herpes simplex or syphilis, reactivation of such infections are not termed as health, are not considered to be healthcare associated. Also, colonization, that is presence of microorganisms on skin and mucous membranes, when they get associated in culture samples, those colonization is not termed as healthcare associated. Also, inflammation due to, which may be due to some injury or due to some chemicals or other things that are not labeled as healthcare associated. So I hope everyone have understood the terminology that is healthcare associated infection. Now it's a very serious thing. It's like a serious killing pandemic of a healthcare associated infection, which is a major global issue for patient safety. About 5 to 10% in developed countries are affected by healthcare associated infection. In developing countries, the condition is still more worse. It is the incidence is about 20 to 25%, especially in ICU settings due to such catheterizations and to intubation and to tubings and catheters. The risk for healthcare associated is even more. If you see in ICUs, the healthcare associated infection affects about 30%, and the mortality may reach about 44%. This is a very serious issue, and there should be measures in the healthcare settings as also in the community settings for the prevention and control of healthcare associated infections. Now, what can healthcare associated can cause? If you see the patient, it leads to mortality, morbidity, and increased hospital stay. If it's in the community, now there is a very thin line of difference between healthcare associated infection in healthcare setting as well as in the community setting. It did now infection due to MRS or VRE, which were once limited to only healthcare setups, are now getting increasingly being associated from community settings also. Increasing cases of antimicrobial resistance in community is being observed. So it's affecting the healthcare associated infection is also affecting the community very badly. And how it is affects hospital? It also affects the hospital in terms of litigations, which have increasingly been reported now. It affects the reputation of hospital and as well as the accreditation also. So healthcare associated infection can affect patients, a community, and a hospital. Now, how it is not that the healthcare associated cannot be prevented. More than 30% can be prevented and can be prevented by simple measures such as hand hygiene. We'll be seeing in detail the measures to apply to prevent and control the infection control. Let us see, consider this study which was done between 1978 to 75. It was a very old, but the conclusion is very important that it was observed without infection control that the incidence of infection was about 9 to 18% to 26% in BSI. But when infection control measures were applied, there was a drastic decrease in the healthcare associated infection. About 25 to 35% was the reduction in the healthcare associated infection simply by implementation of proper infection control measures. Now, let us understand what is this infection control. It is a scientific approach which is based on practical solutions designed to prevent the harm to patients, the healthcare workers, which is grounded on the principles of infectious diseases and rooted in patient safety and quality. Now, who's at the risk of infection? Everyone is at the risk of infection. Not only the patients, not only the housekeepings, the attendants, the nurses, doctors, and but every visitors also within the hospital, within the healthcare setting, or also amongst the community people are also at the risk of healthcare associated infection. As I said in my initial slides, it is a broader term which includes infection outside, after discharge also, among the staff also, and among the visitors and other people, other category of people. Now, what is the benefit? What is the benefits of the application of these measures of infection prevention control? To protect yourself, to protect your family, the community, and the environment, and protecting the patients. Now, there should be smart plan in the healthcare setting if you want to prevent and control the healthcare associated infection. The smart plan stands for surveillance. That is, there should be continuous surveillance. More and more surveillance, continuous, active and passive and continuous surveillance should be done by the infection control team to detect the healthcare associated infection. Then monitoring and auditing of the infection control measures should be ongoing. Then implementation of antimicrobial stewardship is a must. Healthcare associated infections and antimicrobial resistance goes hand to hand parallelly. If we prevent antimicrobial resistance, we might be able to, we will be able to control the healthcare associated infection due to drug resistant pathogens. Now, antimicrobial resistance is a silent killer pandemic going on. It's a serious global urgent necessity to control this antimicrobial resistance. Also, there should be reporting. There should be continuous reporting of healthcare associated infection, and measures should be done. Should be implemented immediately to isolate those patients who are with healthcare associated infections to prevent the cross transmission and transmission of infections. Reporting, like in our setup, we not only the it's not a responsibility of only the infection control team of the committee members to identify the healthcare associated. Anyone in the healthcare setting, say even an attendant or technician or who is not directly related to clinical setup, can also report if they suspect any patient or any with an healthcare associated infection by filling up a form and submitting to the team or the committee members for the root cause analysis and the CAPA measures for the prevention and control of infections. Then training and retraining and education of the staff, as well as also the patient, as well as also of the community, as per the latest NHCA 5th edition, is a must if you want to prevent and control the healthcare associated infections. There should be committee. It is a must as per the circular was passed last week that it is a mandatory for every medical college and every hospital to have an infection control committee, which could include representatives like infection control practitioners, pathologists or microbiologists or IT specialists, the pharmacists, the hospital administrator, representatives from wards, OT or ICU, representatives from departments like medicine, surgery, gynec, obstetrics, pediatrics, and central sterilization manager is also a must member of the HSC committee, and hospital engineer because he can discuss the issues related to construction. The risk assessment can be done related in process in construction and other activities. Now let us see how the infection control team does the root cause analysis and puts up the CAPA measures, that is corrective and preventive measures. Say if it is an increase in surgical site infection, and if it is observed that the skin was shaved the night before the surgery, then what will be the CAPA? They eliminate the shaving. As per the recent CDC guidelines, shaving should not be done a day before the surgery. It should be done immediately before the surgery, and that too preferably by clippers. So, secondly, if you observe by inappropriate perioperative antibiotic prophylaxis given, then a single dose is recommended of antibiotic prophylaxis. If you see that the instrument used for dressings are submerged altogether, then it should be stopped. What is preferred is use individual sterile packs of wound care instruments. So this is how whatever the observations we see as per the guidelines, we can put the recommended measures for the prevention and control of healthcare associated infections. Now, which are the indicators that we monitor for hospital infection control committee? It includes indicators like catheter associated urinary tract infections, ventilator associated pneumonia or ventilator associated event, catheter linked bloodstream infections, surgical site infections, and occupational exposure to blood and body fluids. So these are the indicators that needs to be monitored on a monthly basis if for hospital infection control committee. Now, when we monitor these indicators, we also see the trend. Say, for an example, catheter associated urinary tract infection. We see the trend. What was the trend in the last 6 months? When it cost the benchmark? There should be benchmark. Okay, the setting should send up a benchmark. Say about copy, the benchmark should be about 6.1, which is as per the critical society guidelines. 6.1 per 1,000 catheter days. What is the sample size? Sample size should be 100% with catheterized patients. What is the formula? Formula should be adopted from the NHCA standard, which says that number of catheter associated urinary tract infection, and the denominator should be number of urinary catheter days of that month. Then operational definition should be set up as per the NHCA standard and the guideline, and the trend should be monitored. And then should be observed what was the root cause analysis for such rise in the copy cases. We'll see it can be because of hand hygiene or non-compliance or partial compliance to isolation precautions, and then immediate CAPA measures to be taken. That is, training should be given on the implementation of copy care bundles. So this is how we should monitor the indicators, the device-related infections, set up a definition, set up a formula, set up a benchmark, observe 100% of the sample size, and see the root cause analysis and implement the appropriate CAPA measures. We should have a proper standard operating procedure identified in our manual for the prevention and control of such healthcare associated infections. Then we should monitor other measures or apart from the device-related infection, other measures such as sharp injuries or splashes. We should see which other people who are getting affected. Say about if it is doctors and housekeeping, then what were the root cause, and immediately implement the appropriate infection control measures. Monitoring and auditing should be done. We should observe the hand hygiene compliance, the compliance towards the safe ingestion practices, then towards the usage of personal protective equipment and biomedical waste. The continuous auditing should be done, and we should have a healthcare setup should have a regular audit calendar for monitoring of these health infection control measures. Now for the implementation, everyone should be aware of the healthcare associated infections of that healthcare setting. We can put up a dashboard or a poster in the nursing or the nursing counter, which is accessible to everyone, the doctors, nurses, technicians, everyone, about the incidence of the healthcare associated infection, about the prevalence of the antimicrobial resistance, so that everyone is aware. We can also pass a newsletter to all the clinicians and the nurses to make them aware of the status of the healthcare associated infection of that healthcare setup. Then innovations like measures should be taken to continuously improve and prevent the healthcare infections. Like we had a blood increase in the bloodstream infections. What we did that is we started it is in resource limited settings. We cannot have all the time the split septum needleless connectors. So what we did that we started putting the stoppers into the antiseptic solutions or disinfectant solutions such as alcohols. And we used to disinfect that stoppers and to reuse it. So such innovation can be done, and every people in the healthcare setup should be encouraged for such innovations, and they should be made aware and they should be made encouraged to prevent and control the healthcare associated infections. And if suppose if the department has reduced the infections, such events should be celebrated. The team needs to be awarded, and a team spirit needs to be developed. And also not only the healthcare personnel, but also the patient needs to be involved in our program of infection prevention and control. Now, this was all about the healthcare associated infection and about its implementation. Let us learn in detail about the infection control precautions. Infection control precautions are those precautions that needs to be applied to prevent and control the cross transmission of healthcare associated infection. The most important isolation precautions is of two types. One is standard precaution and another is transmission based precaution. Now, what is standard precautions? Standard precautions is not based on the mode of transmission. Like transmission based precautions is based on the mode of transmission, that is based on contact route or droplet route or airborne route. The corresponding transmission based precautions are applied. But in standard precautions, it doesn't depend upon the mode of transmission. It should be applied to all patients irrespective of the diagnosis status or infection status. It should be applied to all patients receiving care in the hospitals regardless of the diagnosis. It applies to blood, body fluids, non-intestinal skin and mucous membranes. What are the principles of standard precaution? The most important thing is hand hygiene. As I said before, it's the single most effective measures. Then second is gloving. Then third, usage is following proper personal protective equipment. Now it was seen in the last 1.5 years of COVID. It was that what doffing, the proper infection control precaution was not followed while during doffing. That led to the increase in the COVID infections. So proper personal protective equipment training and implement of compliance should be followed to prevent and control infections. Then usage of disinfection of patient care equipment is necessary. Like it was observed that there's an increase in the ventilator associated pneumonia and respiratory infection. What we observed that there's a poor partial compliance to the oral hygiene and disinfection of the respiratory equipment. So we immediately put the corrective measures and could able to control the respiratory infection. So patient care equipment disinfection is necessary. Then safe ingestion practices should be followed. Then linen and laundry management is important. Environmental cleaning is very important. Like hand hygiene, I say environmental hygiene is very equally important, because environment consists of organisms like MRS or VRE. If they are often the culprits in healthcare associated infections. So environmental hygiene is very important. Biomedical waste management is important. It's a very important standard precaution to be followed. Now let us see. Let us understand what is the main culprit. Who are the main culprit of spreading this healthcare? It is the 10 fingers. So if you want to prevent the transmission of infection, we have to follow proper hand hygiene. Now, why hands are held culprit for transmission of infection? If you observe, it spreads to 5 steps. The infection spreads to 5 steps of hand transmission. The first step, germs contaminate the hands. Second step, germs transfer to the other healthcare workers' hands to cross transmission. Third step, germs survive for longer duration if you immediately don't do the hand hygiene. Fourth step, if hand hygiene is done, but it is not done by the proper steps for the proper duration, the hands remain contaminated. Fifth step, then the contaminated hands can transmit the infections to other healthcare workers and the patients and the other visitors and others. So this is how the transmission of infection occurs through hands. So hand hygiene should be done especially at the 5 moments for hand hygiene. Now, what are these 5 moments? One is before touching a patient. Second is before any clean or aseptic procedure. Third is after an body fluid exposure risk. Fourth is after touching a patient. Fifth is after touching a patient's surroundings. Of this, the most important is seen oftenly that at the 4 moments the hand hygiene is followed, but especially at the 5th moment the hand hygiene is often skipped. And as I said before, the patient's surroundings is often contaminated with drug-resistant pathogens. So special focus will be done on this 5th moment, that is after touching a person's surroundings. Hand hygiene is a must. Now let us see what are the occasions before touching a patient. It can occur before shaking hands, taking a pulse or blood pressure or auscultation, inspection, palpation, percussion or auscultation. During such procedures, before such procedures, hand hygiene should be done to prevent the transmission of infection from us to the patient. And similarly, before any clean or aseptic procedures such as brushing the patient's teeth, or preparation of food, or catheter insertions, or tubings and catheter insertions, skin lesion care, before such procedures, hand hygiene should be done not only to prevent the transmission of infection from us to the patient, but also from the patient's own skin flora inside the patient's body. Then after any blood fluid exposure risk, such as after brushing a patient's teeth or after intubation or catheterization, hand hygiene is a must to prevent the transmission of infection from the patients to the healthcare personnel. Then after touching the patient, to prevent the transmission of infection from the patient to us and to the surroundings, like after taking a BP, blood pressure, temperature, or respiratory rate, or inspection, palpation, percussion, or auscultation, hand hygiene after such procedures, hand hygiene should be done. And as I said before, after taking a patient's surroundings, such as holding a bed rails or clearing the bedside tables, changing the linen, hand hygiene is a must to prevent the transmission of infection from the surroundings to us and to the patients. Now we have learned about 5 moments of hand hygiene. Now, even if it is observed, even if you do hand hygiene, if you don't do by the proper method, the hand remains contaminated. I was seen in many times people are doing hand hygiene, but still the dorsum of the hand, the interdigital wave passage, the dorsum of the thumb especially is often missed. So if these are the spaces of this can lodge the pathogens, the pathogen can multiply and can transmit infection. So hand hygiene should be done the proper 7 steps. Let us first understand the types of hand hygiene. One is routine or procedural, and third is surgical. Routine, that is to prevent, that is soap and water should be used for the routine hand wash. For the procedural hand wash, such as tubings and catheter insertion, hand drops should be used. For surgical hand wash, it should be done prior to all surgical procedures like invasive or diagnostic procedures. Now, how to use how to take the let us see the 7 steps. Before, the prerequisite for the hand hygiene is that the hands should be free of all accessories. The sleeves should be folded till the elbows, and hands should be free of all accessories such as rings, bangles, threads, watches should be free from all, because it interferes with the hand hygiene. So that is the prerequisite in a clinical area. Second, take care about the significant amount of hand rub or the hand wash solution into the palms, such as this fills the cup of the palm. Then say about 3 to 5 ml of hand rub is used with either with the elbow or on the heel of your palm, as you see from the picture. Then the 7 steps to be followed, that is palms to palms, then palms to the dorsum and vice versa, then the palm to palms with the finger interlace, then the palms into the opposite palms with the finger with the rotation rubbing of the with the clasped fingers into the opposite palms, and the rotation rubbing of the thumb into the opposite palms, and the clasped fingers into the opposite palm, as you see from this picture, and finally the wrist. So the 7 steps should be followed stringently for a proper duration. Say for a hand washing, it should be done at least for 40 to 60 seconds. For hand rub, it should be done at least for 20 to 30 seconds. So for this seven steps should be followed for the proper duration. As I often see in a hurry, the healthcare person says, the doctors or nurses, they just with one hand get the hand rub solution, but for not even for 10 seconds, they just do the palm to palms and approach the patient. That should be be avoided. I request everyone to follow all the 7 steps for the proper duration and then proceed towards the patient care. Our hands should be completely dry. There is a thing called as contact time. Say for betadine solution, it is a 1 minute contact time. For the alcohol, it is a 20 seconds contact time. For after that contact time, it is the contact time is the time required for the antiseptic or to become active. After that contact time, only the patients or the surroundings needs to be approached. If you approach before the contact time, it is of no use. And that is what is the reason what is leading to the transmission of infections. Surgical hand wash care should be taken that it should dried properly, as we see from this picture. It should be dried in a position as that such that the water will drip from the fingers towards the elbow. And it should be completely dried before moving towards the procedure. So that was all about the hand hygiene. This next important is glowing. Now, glowing is not an alternative to hand hygiene, but gloves should be used for procedures for procedures such. And before wearing and after removal of the gloves, hand hygiene is a must. And if you wear gloves and if you skip with the hand hygiene, that won't do. Hand rub should be done before wearing and after removal of the gloves. Sterile gloves should be used for every surgical procedure like vaginal delivery or radiological procedure, performing a vascular access. Then examination gloves, that non-sterile gloves, should be used for situations such as contact with the mucus, such as emptying the emesis basins, or cleaning the instruments, handling the waste, drawing blood, IV insertion and removal. For such procedures, examination gloves should be used. Gloves are not indicated except for contact precautions for conditions such as taking a blood inspection, palpation, percussion, auscultation. For such procedures, gloves are not indicated except for contact precautions. You'll see what is contact precautions in detail in next slides. Now, this is the most important slide to show. We have seen what is healthcare associated infection, what is standard precaution, especially the hand hygiene. Let us understand how transmission. Now let us see the transmission-based precautions. Transmission-based precautions. Just hold on. Sorry for the interruption, but now let's move to the transmission-based precaution. Till now, we have seen about standard precaution and hand hygiene in detail. Now, let us understand the transmission-based precaution. That is what are the 3 modes of transmission? One is contact route, one is airborne route, and third is droplet route. Now, pay serious attention towards this thing. Because if you want to prevent the transmission of inpatient, let us understand the mode of transmission. The most important first is contact route, which is very logical to understand. Transmission can occur directly hand to hand, or can indirectly occur through equipment. So if you want to prevent the transmission of infection through contact route, we have to apply contact precautions. One is contact precaution. Now, what is contact precautions, and in which infections we have to follow contact precautions? In infections such as burn infections, wound infections, boil infections, infections such as MRSA or VRE, which are very deadly pathogen infections. In such conditions, we have to apply contact precautions. Also, infections such if a patient comes with a diarrhea and dysentery, also contact precautions should be applied. Now, I often see when patient has a diarrhea or dysentery, people often do only hand rub or even don't do hand rub, and they approach the patient. Now, it's a very serious patient with a diarrhea dysentery is a very serious thing. It's not a normal thing to ignore. Our human body always carry this commensal of Clostridium organisms. And in ill patients or chronically ill patients, these Clostridium infections produce toxins, which are very fatal. The word difficile, the Clostridium difficile, stand for difficult to treat and difficult to diagnose. If a healthcare person gets its infection from a patient due to Clostridium difficile, which is common in diarrhea and dysentery patients, it is very fatal. And for such diarrhea and dysentery patients, hand wash should be done, not hand rub. Hand wash for a proper duration, that is 40 to 60 seconds with soap and water, should be done to prevent transmission of infection from such toxin producing Clostridium species. So I repeat again, contact precautions should be followed in burns, boils, wound infections, and diarrhea and dysentery patients, especially with hand wash. Hand wash is a cumbersome process for 40 to 60 seconds. Hence, people do hand rub, but that should be avoided. If you prefer medical hand wash, which is soap and water. Even if antiseptic soap is not available, it is plain soap and water should be done hand wash, especially for diarrhea and dysentery patients. Now, what are the counter precautions? Along with this hand wash, the other two things, that is gown and gloves, should be used for patients infected with contact precautions. A suggested measure is that if a patient with a contact infection is there, such as burn infection or boil infection, outside the patient door, a contact precaution poster can be posted to aware the healthcare personnel before approaching the patient to wear gown and gloves and follow strict hand hygiene. So that was about contact precautions. And another next thing is airborne and droplet infections. If I often ask people how the tuberculosis spreads in my audit, and people answer it as a droplet infection. Understand the difference. Droplet infections are due to infection where particles or the pathogens are more than 5 microns in size. While in airborne infections, the pathogens are less than 5 microns in size. Airborne infectious particles doesn't spread more than 3 feet distances, but droplet infections doesn't spread more than 3 feet, spreads less than 3 feet. It immediately falls to the ground and becomes non-viable. But the airborne infection can spread more than 3 feet. It can spread to 6 to 13 feet, especially the COVID infected particles. Airborne infections remain suspended for a longer duration. A TB infected patient can, if sneezes, the particle can remain dormant in the air for 24 hours. If the air changes per hour is not adequate, if it's less than 6. But if it is hence air changes, it all depends upon air changes per hour. That is the volume of the air that gets replaced every hourly. In an ICU, it is about 6. In an OT, it is about 12. In COVID room, COVID rooms, it is about 18. It is at times increased to 45 also. The more the air changes per hour, the more easily the airborne infectious particles get removed from the air. So airborne infectious particles depends upon the air changes per hour. Now, what are the airborne infections? Tuberculosis, measles, chickenpox, pandemic flu, pandemic COVID are examples of airborne infections. Now, diphtheria, pertussis, meningitis, seasonal influenza are examples of droplet infections. Now, what to follow in droplet infections? Plain mask, surgical triple layer mask should be used by both the healthcare personnel and the patient in droplet infection. But for airborne infection, healthcare personnel should wear an N95 respirator, and patient is instructed, or the infected person is instructed to wear a mask. N95 respirator is a must for airborne infection by the healthcare personnel. If it is not possible, then a cloth over which a triple layer mask can be used in a resource poor settings. Also, the airborne patient with airborne infections should be isolated into a negative ventilation room. Because being in a highly pathological infection, the airborne infection patient should be isolated in negative ventilation, and healthcare personnel should not skip for wearing N95. N95 stands for filtering efficacy, while N stands for not resistant to oil. Hence, when N95 becomes dusty or dirty with oil and grease particles, it should be immediately replaced, because it won't be of any use. It should be used only for 8 hours. But in resource limited settings, it can be reused. But for reuse, it should be properly kept in a porous paper envelope, and can be used after 8 hours for the next day, or after 3 to 4 days, as per the ICMR recommended reuse protocol. So that was about airborne and droplet infections. I repeat again, for airborne infections, N95 respirators should be worn by healthcare personnel, and patients should wear a mask, and the patient should be isolated in the negative ventilation room. While for droplet, only a mask is sufficient. So that was about standard precautions and transmission-based precaution and hand hygiene. Now let us see the other measures. Safe ingestion practices. Safe ingestion practices should be followed. Now just guess how much. It is about 40% of the HIV, HBV, and HCV among the healthcare personnel are because of this unsafe injection practices. So if you want to prevent such transmission among the healthcare personnel, 40% is a very high figure. We have to follow proper safe injection practices to prevent this transmission of this blood pathogens. What is those measures? Reinsertion of the used needles into the multiple dose vials or solutions should be avoided. The same needle, it should be the principle is one needle, one syringe, only one time. If you are using it for the same patient multiple times, the same needle and syringe should be avoided and never for the other patients. So one needle, one syringe, one time the protocol should be followed if one prevent the transmission of such HIV. If a multiple dose vial should be used as per the manufacturer instruction, it should be used within 24 hours. If a multiple dose vial such as hepatitis B vial we are often using, most of the times it is left uncovered. It should be covered properly. Closed system should be followed and should be preferably used within 24 hours, and preferably single dose vial should be used. Use of a single syringe should be avoided to administer medication to multiple patients. Face mask should be used during procedures such as lumbar puncture or central line insertion. Respiratory hygiene is a must, that is sneezing into the elbow or covering the nose and mouth with a tissue paper and discarding the tissue paper after sneezing or sneezing into the dustbin. Respiratory etiquette should be followed. Then personal equipment. As I said before, it was seen in the last 1.5 years, doffing, partial compliance or non-compliance. People were not educated how to doff it. And it is, for example, after doffing of every PPE, that is gown, gloves or mask, a hand hygiene should be done. That was often skipped, and that was leading to contaminated doffed materials, infecting the healthcare personnel and leading to inpatients like COVID. So proper donning and doffing should be done. It's a major risk, especially during the doffing, that is what is leading to infection. So if you see the correct sequence of the donning and doffing should also be followed. If you see for donning, shoe cover, then cap, mask, apron, goggles, finally gloves. Before wearing and after removal of gloves, hand hygiene should be done. While during doffing, first it is the gloves, then comes your mask, and then the reverse procedure. And for every doffing of every item, hand rub should be done. So that was about personal protective equipment should be strictly followed the sequence, and doffed material should be after doffing of every item, hand rub should be done. As I said before, occupational exposure to blood and body fluid. See, if you see in a healthcare setup, if you get an unprotected exposure to blood and body fluid, how much is the risk for hepatitis B? It is about 30 to 60%. For hepatitis C, it is about 10 to 30%. For HIV, it is about half to 3%. So there's a high risk in a healthcare setup when we get an exposure, unprotected exposure to blood and body fluids when it is unprotected. Such is a high risk of transmission by hepatitis B. Even a dried blood spot can remain infected for hours, for days, if it is not immediately disinfected. So this is a very hence environmental hygiene, then safe ingestion practices should be followed. And this is very common. This exposure is common due to scissors or blades or needles. Most of the times, hollow bore needles are the cause of injury in 70% of the cases. It especially occurs after use and before disposal. Hence, when a sharp instrument is used, it should be immediately discarded. It is seen that often it is left unnoticed into the linen and laundry, and the housekeeping is often getting this injury. So that I request, because it's a single injury or single exposure cost lakhs to the healthcare setting. Not only it is an economical burden to the healthcare setting, but also it is a risk to the healthcare personnel. Now, what measures should be done to prevent such injuries? Avoid the use of needles as far as possible. You can use a needleless split septum connectors for vascular access, or avoid recapping of the needles. Then don't bend, turn or the needle or sharp instrument. Then use a tray for handling for transferring of the sharp instrument. Uses forceps for handling the sutures. Immediately discard the sharp. Follow a single touch method for recapping if it is to be done, but it should be avoided as far as possible. And use as far as possible by safe equipment, and use of immediately take the post-exposure prophylaxis. For an HIV, the prophylaxis should be taken within 72 hours, and for hepatitis B within 24 hours. If we get such exposure, the cuts or the injured site should be washed with soap and water. It should not be put reflection into the mouth. It should not be squeezed, and should be washed with plenty of water. If eyes are involved, it should be irrigated with clean water. Then immediately the supervisor should be informed. A casualty or the emergency department should be approached for the immediate infection control measures. And then HIV, HPV testing should be done. Then it should be done at 3 months. Then at 6 months, and after 6 months, if it is not infected, then the file is closed. if the patient, if you get an exposure from HIV to a patient, then HIV prophylaxis within 32 hours should be taken and should be taken for 28 days. And if it is by an hepatitis B patient, then a titer should be checked. And to give up the vaccination or not, it depends upon the titer. If the titer is more than 10, then no booster or no revaccination is required. But if the titer of hepatitis B is less than 10, then revaccination is advised. It is seen that about 5 to 10% of the healthcare personnel out the population are non-responders. Such personnel should be avoided from such such exposure-prone activities. So that was about occupational exposure to blood and body fluids, the measures to be taken and what to be done immediately if exposure. Let us see the next thing, that's biomedical waste. What is biomedical waste? It is any waste, it is any which is generated during the diagnosis, treatment, or immunization of human beings or animals or in research activities pertaining thereto. In short, it is any waste which is generated during the patient care. Now, how much of the hospital waste is infectious? It is in just 10% of the hospital which is infectious, rest 90% are non-infectious, 85% is non-infectious, 5% hazardous. To prevent the mixing of this 10% within 90%, we should do proper segregation. Otherwise, the entire hospital waste is infected. So it is discarded or segregated into different color coded bins. We have yellow color bin, red color bin, blue color bin, sharp containers, and all these bins are comes with a biohazard symbol. Black is not it doesn't have a biohazard symbol. It's not for infectious waste. It is for non-infectious waste. Now, what goes in yellow bin with a biohazard symbol? All those non-rubber, non-plastic waste goes into yellow bag. And all those rubber and plastic waste goes into red bag. Now, what are those non-rubber, non-plastic things? Anatomical waste, animal waste, discarded medicine. Discarded medicine should be in a different yellow color bag with a certain sign. Discarded linen, laundry, or only microbiological waste goes into yellow bag. Cap and mask will go into yellow bag, while gloves will go into your red bag. Urine bag will go into red bag, but blood bag will go into yellow bag. So such posters of such segregation should be placed where the waste is generated. We can have, I suggest this practice, you can keep such labels over the color-coded bins. Red and yellow color and blue color posters can be placed over the bins for easy understanding of the healthcare personnel. Then all the sharps will go into sharp containers. If the sharp container is sealable, we do avoid putting disinfectant solutions like sodium hypochlorite. If it is not sealable, it is open, then 1% sodium hypochlorite should be used for disinfection of the sharp instruments, which should be freshly prepared. All needles, syringes with needles will go into sharp containers. Plain syringes will go into red, but syringes with needles will go into white. In blue bags, all your glasswares and metallic implants should be segregated. So that was about the segregation of biomedical waste. Biomedical waste requires compliance, is a legal requirement for compliance. If you don't do proper do segregation, there's a fine up to lakhs of rupees and also imprisonment also. So it's not only for the prevention and control of healthcare asset, but it's a legal thing also too. The next thing is antibiotic policy. Every healthcare setting should have an antibiotic policy which guides the clinician for empirical therapy for the patient. Well, so that the right drug for the right bug for the right patient can be selected. So antibiotic policy is a must for every healthcare setting, which depends upon the antibiogram. For the antibiogram, it's a representative of the organisms present in the hospital, which are the organisms present in the hospital, for which antibiotics they are resistant or sensitive. That is an antibiogram. So every healthcare setting should have that antibiogram prepared every monthly and updated, and should be made aware to every healthcare personnel, especially the clinicians, so that the empirical therapy or the right therapy is selected for the patients. We can have such a real-time antibiogram.
Yeah.
I will.
Dr. Rahul? Yeah,
Yes.
we will have to end the session now because we are going to have psychology lecture.
Okay.
So do you want to just wind up?
Just simply wind up within a minute. So, I'll discuss about this antibiogram and antibiotic policy. Then stewardship strategies such as restrict the antibiotics which are of high alert antibiotics like cholecystine. Use it only rationally, and audit should be done for the consumption of antimicrobials, and proper strategies should be followed to prevent antimicrobial resistance. lastly, healthcare associated infection as per Consumer Protection Act comes under medical legal issue. So if you want to prevent or defend such a healthcare associated infection, measures should be taken for stringently for prevention control of such infections. To summarize, we have seen about healthcare associated infection, the standard and transmission based precaution, the biomedical waste management, how to manage occupational exposure. So that was all about health infection control practices. I thank all the participants here for their kind attention and best wishes to you.
Thank you so much, Dr. Rahul, for such a short time. You've covered up so many topics. There were some who said that you're very fast. Actually, we know you're an auditor. You keep on asking questions and all that. But yes, you have shared a lot of information, and definitely it will benefit all of them. And yeah, Dr. Rahul, we will have you next time with more other topics. Can you tell us with some of the topics what people like what auditors normally ask?
Auditors mainly for ask to the doctors, they ask about the antibiotic policy and the antibiogram, and to the nurses the most common question is how demonstrate the hand hygiene measure, hand hygiene procedure, and then the 5 moments of hand hygiene, the 7 steps, then about safe ingestion practices, then the disinfections of the equipment, which instrument they ask the nurse, how do you disinfect the ambu bag or the laryngoscope. So disinfection is asked, hand hygiene procedure is told to demonstrate, and the 7 steps and the 5 moments are the common question asked to the nurses. But to the doctors, it is the antimicrobial stewardship and the policy and the antibiogram. To the housekeeping, they asked to demonstrate the blood spillage and the disinfectant dilutions. That is the questions asked.
Okay. Thank you so much, Dr. Rahul.
Welcome once again. Thanks to the NHCA team for giving me this opportunity. Thank you.
Yeah. Dear students, I just want to inform you all, some of you have asked for the PPT. So subscribe to NHCA channel. It is there on YouTube. You can go through the link. He has given all the latest CDC guidelines for all the, you can see the link, click that, and this lecture is there. The PPT slides are there. So you can go along with that and go through all the slides. Okay. I hope you all enjoy this session. Tomorrow we are having hospital